Good day everyone, my name is Shaharali Reyes from BSN 12B and today I am going to perform the parenteral drug administration. Parenteral drug administration refers to drug given through oral, intradermal, intramuscular, intravenous, and subcutaneous routes. But for today's video I am going to perform the intradermal, subcutaneous, and intramuscular routes. But first we need to prepare the medication. Now, in preparing the medication we need to remember the 10 rights of drug medication to ensure patient safety. And we need to check the doctor's order and the medication administration record so that we'll be able to identify what drug to be administered to the assigned client. And check also the 3 important medication administration, such as checking or reading the label of the medication when it is taken from the medication card, and read also the label of the medication before withdrawing, and we will also have to check or read the label again after withdrawing the medication. And after that we need to prepare the necessary equipment to be used, and this is to conserve time and energy, and this includes syringes, the hypodermic tray, our forceps, alcohol, cotton ball soap and a 70% alcohol, distilled water which will serve as our medication, ampoule, a pen, a gloves, and a waste receptacles over here. So I'm now going to proceed with the preparing of the medication. But before that I'm going to need to perform a hand hygiene and observe appropriate infection prevention procedures. So prepare the medication vial from withdrawing and clean the cup of the open vial with a cotton ball soap and a 70% alcohol, and so clean it in a circular motion to ensure its sterility. Then discard. And now prepare the syringe and open the pocket of the syringe. And it's also important to remember to only touch the barrel and the plunger of the syringe to avoid contaminating the needle. And since my syringe comes with the needle, I'm gonna loosen it up and connect my syringe on my aspirating needle. So I have here. Then so connect my syringe with the aspirating needle, and then we also need to ensure that the needle is firmly attached to the syringe by rotating it. Now remove the cup of the needle. Then draw into the syringe the amount of air equal to the volume of medication to be withdrawn. Then, after that, carefully insert the needle into the upright vial through the center of the rubber cup. And maintaining the sterility of the needle, then push the air and withdraw. And if you observe any bubbles, split the syringe and continue. Now hold the vial down. And now remove the needle tip. And discard this aspirating needle. And connect this barrel now to the appropriate size of needle. Then place it into a hypodermic tray. I'm going to proceed to the preparation of the medication in an ampoule, but first I'm going to prepare my syringe, and have here my 5cc syringe. And open the bucket. And since my syringe comes into the needle, then I am going to loosen it first. So I can connect it to the aspirating needle. Then connect it. And make sure that the connection isn't loose by rotating it. Then set it down first. And now is take the ampule and flick the upper step of an ampule several times. And now is place a piece of cotton ball soaked in alcohol, means 20% alcohol, and between thumb and your forefinger is wipe the ampule neck. Then break the ampule neck on top of it by bending it toward you to ensure that the ampule is broken away from yourself and away from others. Now is discard the broken neck of an ampule, then place the ampule on a flat surface. Then we're going to take our syringe and remove the cup of the filter needle. Then insert the needle into the center of the ampule. Now I'm going to take the aspirating needle and discard the aspirating needle and connect the barrel down to its appropriate size of needle and place it into the hypodermic tray. So then now I'm going to head over to my patient's room. Hi ma'am, good morning. My name is Shahari Reyes, a student here at Davao Doctors College. And may I see your reason, ma'am? And please state your complete name and your birthday. Okay, Ma'am Liza. So today now is I'll be performing a intradermal injection. So this medication will produce a small wheel or a lab. It's like a small raised area like a blister. So you will feel a slightly prick as the needle enters the skin. And the purpose of this skin testing map is to test if you have allergies on your medication. Okay? And do you have any questions or clarifications, ma'am? Okay, so as you can observe now is I'm providing you a privacy by closing the curtains and the door. And now is I'm going to need to prepare now the medication. Now is I'm going to select the site to be injected. So 3 to 4 widths above your wrist below the antecubital space, then apply a clean gloves. Then now is clean the skin at the site. So using a firm circular motion, starting at the center and widening at the circular outward. From center at outward. Then discard this cotton ball and aim in our waist balls over here. Then now then allow the gradient to be dry thoroughly, and by making it to be dry is we're going to prepare now the syringe. So I'm going to remove the cup of the needle and expel any air bubbles from the syringe by tapping it. Now, grasp the syringe in your dominant hand, which is my right hand, and holding it between the thumb and the forefinger. Then hold the needle almost parallel to the skin surface with the bevel of the needle up. So with my non-dominant hand, is hold the skin at the side until it is taut, and insert the tip of the needle far enough to place the bevel through the epidermis until the dermis. And inject the medication carefully slowly so it will produce a small wheel on the skin. Now is withdraw the needle quickly at the same angle at which it was inserted. Then discard the syringe and draw mark the inserted area. And now is apply a cotton ball on the inserted area. And do not massage the area that was inserted. Okay. So we're now done with the procedure. So ma'am, I'm now done injecting. So I'm encouraging now ma'am to please then massage the area. And after 30 minutes is I'll be evaluating the condition of the sites, okay? Okay, so if you have questions or clarification, then if you need someone, just press the button beside you so that I'll be come right to you and assist your needs. Okay? So thank you for cooperation ma'am and have a great day. So now is remove and discard the glove and perform hand hygiene and evaluate the condition of the site in 30 minutes depending on the test and measures and the area of redness and induration in millimeters at the largest diameter. Then document the findings of the procedure. Now is I'm going to perform the subcutaneous medication administration. So after preparing the medication is hand over to the patient's room, introduce yourself to the client, verify the patient's identity using the two identifiers, explain the procedure to the client and ensure patient's privacy. Good morning ma'am, my name is Parenteral, a student nurse in Doctor's College. And may I see your recent ma'am? And please state your complete name and your birthday. Okay, and what do you want to call ma'am? Okay mga guys, so today ma'am is I'll be administering your insulin to help your body control the blood sugar for your type 1 diabetes, and I'll be injecting the insulin in your abdomen. Okay? So do you have any questions or clarifications? Okay now. So as you can observe ma'am, is I'm now providing your privacy by closing the door and the curtains for your dignity, and so no one from outside will disturb us while we during the procedure.
So, for the subcutaneous injection is we need to select a site that is free from lesion, free of tenderness, swelling, and we'll have to apply a clean gloves. Then clean the selected site using an antiseptic swab, starting from the center, going outwards. Then we'll have to prepare our syringe for injection while waiting the selected site to be dry. Then uncup the syringe. Now pinch the skin. Hold the syringe as if you're holding a dart. And then inject the medication into the patient. So we are going to inject the needle at a 45-degree angle. Now is release the pinched skin, then support the syringe, and we'll have to push the medication in. And after that is remove the needle in the same angle as it was inserted. Then dispose the used syringe by not cupping the needle. Then apply a clean cotton ball.
Okay, so I'm now done ma'am. I'm now going back to the nurse's station. And if you need anything, just push the button right beside you so that I can come to you and assist you here. Okay? Do you have any questions now or clarifications? Okay, thank you for your cooperation ma'am and have a great day. So after doing the procedure is discard the gloves and perform the aftercare of the equipment and perform hand hygiene. Now is document the procedure done. And the next procedure is intramuscular injection. So after preparing the medication, is head over to the patient's room and introduce self to the client and verify the client's identity using the two identifiers and explain the procedure to the client and ensure the patient's privacy. Good morning ma'am, my name is Shahari Reyes, a student nurse in Doctor's College. And may I see your receipt ma'am? And please state your complete name and your birthday. Okay, and what do you want me to call you ma'am? Okay ma'am, so today ma'am is I'll administering your streptomycin. So it is an antibiotic drug to help you to cure your tuberculosis. And I'll be injecting this in your deltoid muscle, which is here. Okay. Okay, so do you have any further questions, ma'am, or clarification? Okay. So as you can observe, ma'am, is I'm now providing you privacy by closing the door and the curtains. And now is I'm now going to prepare the medication and just assist you in sitting position.
For intramuscular injection is we have to select the site that is free from lesion, inflammation, swelling, and tenderness, and apply a clean gloves and clean the site of the injection using the antiseptic swab starting from the center, going outward, and discard. Then prepare the syringe while letting the site dry. So we are going to get our syringe and take our syringe. Now is uncup the syringe and hold the syringe as if that you were holding a dart. Then slightly pull the skin. And inject the needle into the patient's skin in a 90-degree angle. Slowly. And aspirate see if there is a blood. Then if there is a blood, then remove the syringe and get a new one. If there is no blood, then we can now administer the medication slowly for about 10 seconds. Then remove the needle to the patient's skin, then in the same angle as it was inserted. Then discard this needle and apply a pressure to the injection site. Okay.
Okay, so now done, ma'am. I'm now going back to the nurse's station. And if you need anything, just push the button right beside you so that I can talk to you and assist you here. Okay? Do you have any questions now or clarifications? Okay, thank you for your cooperation, ma'am, and have a great day. So after doing the procedure is discard the gloves and perform the aftercare of the equipment and perform hand washing. Now is document the procedure done.